Okay, we're live.
Hello, I'm Mark Unkefer and of the Montgomery County Republican Club, and welcome to our Innovation During the COVID Crisis direct line. And tonight we've got two guests. We've got former Governor and Senator George Allen of Virginia and Dr. Jeremy Ackerman, who is a doctor in Atlanta. And I understand Doctor, you've got to leave quickly, so we were going to kind of lead off with you. And I know that you're a friend of both Dwight's and Marcus's, who probably know all the dirt about you. So they were gonna do a little bit of an introduction for you.
Well, as you know, Jeremy's old friend, what's math science magnet program, Montgomery Blair High School, longtime friend. We reconnected several years ago on Facebook, the magic of Facebook, and we got to talk. And I go, "Hey, Jeremy, we do this little show called Direct Line. We need to have you on." So, and that's how we got here. Marcus.
As far as we're, I guess, interested in your perspective of both just how things are being addressed medically as well as educationally. I thought that would be an interesting topic to discuss with you. So,
sure. Dr. Jeremy, it was 100 years ago, just over 100 years ago, that we had the what was the Spanish flu, although I've been corrected that I guess it came from Kansas, which killed about 50 million people, including some 600,000 Americans, which was obviously a larger number at that particular time. So we've had experience with large pandemics in the past. What lessons should we have learned from those past pandemics?
So, I think that particularly that most recent pandemic points out, we can see big differences across different cities where there were efforts to sort of separate people out and not have large gatherings and take other kind of more public health measures to try to control spread of the infection, and where their lethality rates were much, much lower. So certainly we can see that in those pandemics. What unfortunately we don't have a really good example of from those pandemics is really how to manage modern healthcare. At that time we didn't have modern ventilators. The reality is what we could do in hospitals was much, much less than. Giving somebody IV fluids at that point in history was a really big deal. Whereas on a normal day in my emergency department, it's sort of unusual for me to not start an IV on a patient and start fluids. So the level of what we can deliver is much higher. The challenge becomes in a pandemic is whether we really have enough resources to get everybody what they need. And unfortunately, what we're seeing in places like Italy and now New York City is that it's fairly easy to saturate our healthcare systems and not be able to deliver everything that we'd like to be able to deliver for patients.
So I guess one of the questions you've talked about, those cities that acted quickly, it does seem that there's also a kind of correlation between the more densely populated areas, certainly the ones that have to depend on mass transit. People can't drive, and is that a factor? Is there a connection there, and does that mean that rural areas are in a different position?
At face value, there probably is, and unfortunately, slight differences in different places can make a huge difference. Living down here in Georgia, I've been watching the statistics and the rates of spread and what our emergency departments look like. And, the city of Atlanta and the more heavily populated counties were more aggressive than other parts of the state in pushing for different forms of shutdown and separation, whereas statewide we've been relatively slow to adapt those kinds of measures. And what we've seen is actually there's probably higher than expected rates of COVID-19 infections in the more outlying areas. And although we definitely have larger numbers in the urban areas, so far we've had much lower rates than we would have expected even a full week ago. So we haven't actually saturated our hospitals in Atlanta, whereas some of the more suburban and rural hospitals are starting to get to that point of saturation. So yes, things like public transportation and population density are really important factors. But when these sorts of separation are implemented well and people actually follow the instructions, it really can have a major impact.
Now, obviously, we're all waiting for a vaccination. Hope is that vaccination can mitigate this. Any predictions as to how long that would take?
You know, in general, when we're talking about a vaccine for a new infection, usually the generic answer is about a year. With this particular infection, in part because COVID-19 is not a completely novel virus, and that we have other coronaviruses, we have MERS, we have the first SARS, that sort of form a basis for vaccine development and production. The rumor that's going around and from some more reliable sources is that we may have vaccine available as soon as this coming fall. There are some rumors going around that the CDC and other agencies that will have control over the vaccine may be prioritizing healthcare workers in addition to other higher risk individuals. At the same time, making a vaccine, testing it is a little bit of a tricky business. And so I wouldn't be counting on having that vaccine in the fall, unfortunately. This is one, I'll believe it when we have it in hand and we've got some data that says that it actually works.
Now, you actually touch on one of the challenges in the vaccine world. I guess if you use the flu vaccine as a metric over the last couple of years, there's a kind of broad variation as to the effective rate for that. So I think it sometimes is as low as 10%, sometimes it's up to 60%. Obviously, it clearly there has some significant advantages, particularly for people who are at risk. But is making a low effective vaccine worth it?
The short answer is that it's better than having no vaccine at all.
Okay, fair enough.
We see in seasons where the flu vaccine doesn't have a very high level of effectiveness, that in areas where there are higher rates of vaccination, it's not that we completely flatten out the impact of flu, but reducing even by a few individuals the number of people who are susceptible and who can transmit an infection, it does have an impact on the overall population. You know, the phrase flatten the curve has sort of gained a whole lot of traction recently. And the whole notion is that if we take a typical infection, that maybe each day, if I'm a carrier, I might be able to transmit to 4 people. If we can reduce that number even a little bit, it slows down that rate of spread throughout a whole population. It leaves us in a situation where we don't have large sections of the workforce incapacitated at once. We don't have all of our healthcare resources saturated all at once. And that by itself has a huge impact, both financially as well as on healthcare systems and our ability to take care of people.
Now, I think I hear you saying, based at least on the Atlantic experience, that social distancing is working. Could it be more effective, and are there alternatives that might make it more effective that we're learning about?
And the hard part about a lot of the things that we do to mitigate a bad outbreak, or in this case, a full-on pandemic, I think there are certainly a lot of things that could have been done better. Beginning with degrees of social distancing earlier probably would have had an impact. We know, and this is unrelated to COVID-19, that in healthcare and outside of healthcare, people just are not that good about washing their hands. And it's one of those little things that makes a huge difference. And so there are a lot of pieces that may trickle down into what we do in everyday life, like making sure that we're washing our hands more frequently, and teaching kids about doing that, being more careful about coughing and sneezing, that ultimately may make a bigger difference both in this and in the long run. I think having a more uniform and earlier intervention probably would have helped. When you look at places like New York City, unfortunately, they were faced with multiple sources of people who were carrying the infection in a high population density area with lots of reliance on public transportation, with a lot of crowds. And I don't think early on there was effective messaging about how easily this would spread, that just made it a bit of a disaster then.
Now, was it messaging? I mean, you're talking about kind of those early responses by the public health community. Were they too cautious in responding, or were they, making the best of the information they had available to them at the time?
I think it's not the message that they had, it was the traction they were able to get with the message. So I think most of the public health folks have been fairly consistent, but it has been both in terms of news media, in terms of politicians, in terms of everybody who really rapidly informs public opinion and gets people to change behavior. Having one public health expert get up and hold a press conference, the reality is that has very little impact. It's the talking heads, whether it's on social media, or folks that have a much more visible audience, saying that this is important, this is something that we need to be doing.
Now, we talked about vaccinations before, and I guess this probably is going to open up the question about vaccinations in general. How do you respond to the arguments that the anti-vaxxers make? Is this a good time to kind of address those issues?
As somebody who's made efforts over the years to try to address anti-vaxxers, it becomes a challenge that there's almost no science that actually supports their position. It's hard for me to tell somebody that they have to do something to their body that fundamentally they don't want to do. At the same time, when it is clearly putting other people at risk and not just themselves, it's problematic. It becomes a little bit of an ethical problem of, how far can we push to compel folks? I don't know what argument is going to push people that truly believe that there's a problem vaccines, that there's no benefit in vaccines. The science is clear. The science that has said that there are problems has almost entirely been refuted or recanted. So I don't know what to do on that front.
So the short answer is, if you're in a high risk category, you should be one of the first to take the vaccine. And if there's more vaccines become available, then other people should take it as well.
I think that's the bottom line. Hopefully those who have access to the vaccines will come up with good strategies. It may be that we actually are not vaccinating kind of the folks who are at highest risk to get sick from this first. We may, in fact, be targeting the folks who are most likely to be spreading the infection first. So the healthcare workers that are working in nursing homes probably need to be very high priority, because they, if they get sick, are going to put a lot of people at risk, whereas the individual residents of a nursing home may not be the first priority, because if we can limit their exposure in the first place, they are going to be less high risk. It's going to depend on how much vaccine we have available, how effective it is, and these are all things, unfortunately, we're going to continue to learn as we go.
Sure. So one last question, and I guess now Germany is Chancellor Merkel announced today, I guess, moving towards reopening, do you have any particular additional advice that you would have as to at what point and how we should begin to transition to a sort of a less hunkered down society?
Right now, I don't. And part of that is down here in Atlanta, although our number of days or weeks until peak keeps on getting pushed back a little bit.
Mm-hmm.
We're in a little bit of we're waiting for things to get really bad, and we're anticipating it. Thankfully, our time until sort of peak has been gradually getting pushed back, and our numbers are only gradually getting worse. And right now, we're about 2 weeks out from when we're anticipating kind of being in our worst place. The challenge really becomes, what does coming back to normalcy look like?
Right.
And my fear is that if we too rapidly go back to full-on business as usual, we'll be at one point on this curve and then immediately start an uptick of cases and end up in a worse position than where we might have been if we had hunkered down a little bit longer. And the other challenge is that each community, each state is a little bit different situation, both in terms of what business as usual looks like, as well as risk factors within those communities for individuals and risks of transmission. And so I think probably it's going to be more incumbent on states and local governments to try to figure out how to get things going again and reduce the overall risk. We also have a huge problem that just financially, this is not something that is sustainable over a longer period of time. We have a lot of folks who are unemployed because their businesses are closed. And somehow we have to be able to help those folks out and figure out how to get folks back to work so that they can feed themselves and their families without increasing the risk to everybody.
Marcus, I think you had a question.
Yeah, you touched upon some of the risk factors. It seems, is it that there's perhaps a urban versus suburban versus rural sort of profile, or I'm not sure what the nomenclature would be as far as risks, and also with the potential of reopening schools in the fall, that seems like it's going to be a challenge, at least on some level. I don't know if you can touch upon either of those.
I can try to touch a little bit on all of them. Certainly, in more urban centers where people are closer together, it's a little bit more obvious how this would rapidly be transmitted. But that's not to say that in rural communities, folks don't get together. And so gathering together for church, at the grocery store, at a local bar, are all things that have potential to spread an infection just as rapidly, but across a smaller community. And unfortunately, we've seen some outbreaks in smaller communities, and our nursing homes are particularly susceptible of one person coming in,
right,
and suddenly there are a whole lot of sick individuals. In the rural communities, the ability to respond medically is much less. So, in the picture behind me here, I've got a very large hospital that I work at, and right now we've figured out how to ramp up and create additional intensive care unit beds. We have our emergency department set up to handle many more patients than we normally do, even accommodating for the needs to isolate the patients who are coming in. Whereas in a rural community, the hospitals just aren't going to be that big. And the ability of the staff and just the physical plant is going to be hard to compensate for a unexpected kind of follow-on infection. In terms of opening schools, I mean, it's a very real challenge. It's very similar to the challenge of the nursing home. The good news is, although we are seeing some kids that do get very sick and young adults who've gotten very sick from this, by and large, that's the exception rather than the frequent outcome. But the kids become that pathway for, even if they don't get very sick, of spreading an infection more broadly across the community. And so I think we're going to have to think very carefully about how we get the schools back open and the timing of doing that. The good news is many of us in education are getting very good, or at least trying to get very good at using media like this and coming up with creative ways of teaching and testing. And hopefully, many of us will have a summer break to try to assess what we've done in kind of this crisis mode and try to figure out how, if necessary, to keep things going without, not teaching our students.
Well, thank you very much. It's been a very insightful. We appreciate your sharing your experience with us, Dr. Jeremy Ackerman. Thank you very
Doctor.
much.
Yep. Thank you, Doc.
Thank you.
Thanks for having me.
Yep. Thank you very much.
So let's now introduce our next guest. We have former governor and former Senator George Allen. So welcome. I appreciate your being on the show, Governor.
Well, great to be with you, Mark and Dwight, and whoever else is watching this podcast. I appreciate your resourcefulness in trying to get this information out to people who are looking, I think, like a lot of us, to reopening and uncaging American lives and livelihoods. And it's a pleasure to be on this podcast, in that I want to actually hear from all of y'all, and whether we hear it in this podcast or not, I've been appointed to a really great heritage initiative. It's called the National Coronavirus Recovery Commission. And we can discuss this during all our time here, but if people have ideas, constructive ideas, that we ought to be looking for in our commission, which is putting together ideas that can more promptly reopen America's economy for lives and livelihoods. And you can go to coronaviruscommission.com, coronaviruscommission.com, and share your ideas with us on this. And let me just broadly say what I think, and it was great to listen to Dr. Ackerman. I was taking notes from his perspectives, and there's certain things that need to be done, in my view, right now, that urgently still get the N95 masks, the protective equipment to those on the front lines, and all the doctors, nurses, healthcare providers are really patriotically and courageously risking their lives or their health to help others and care for others. And we salute all of them wherever they are in our country. And on the next stage, I think, for reopening, and I agree with Dr. Ackerman, it's going to be done by governors looking at the differences in their states. And that's the way it ought to be done. And as Dr. Ackerman said, every place isn't the same. You all asked that same question. Ocean City and Baltimore and Montgomery County and Cumberland County, Maryland, are not the same. Just like New York City's different than Sioux City or Gate City or Oklahoma City. And I think the governors are going to look to reopen, and they're going to do it on a community or region by region basis. One of the things that I think is absolutely essential is we get more of these rapid tests out. This has been a game changer, this rapid test identifying whether somebody's got this COVID-19 or not. Abbott Labs is the one who developed this, and I think whether it's that or something similar, that you can find out within 15 minutes whether or not you have this virus, rather than sending the swab off somewhere to a lab and you find out 5 days later. Well, that's too late if you want to stop the spread of it. The other thing that we've learned from this, and I would have loved to ask Dr. Ackerman, but we'll all have to look at the concept of proportionality here. And what I want to bring to this National Coronavirus Recovery Commission is the concept of positive, constructive ideas, a positive outlook, but also an idea of balance and proportionality to all this. And what we're learning is, as Dr. Ackerman said, the places that are most dangerous are crowded cities. And New York City is as crowded as any city in our country. And then mass transit or public transportation is another major factor. And that's why you're seeing it worse in every state you could look at. You could look at North Carolina, it's Raleigh, Durham area, and the Charlotte area. In Virginia, it's Northern Virginia, the Richmond area. Those are the top two areas. But then you can see some places that have an abnormality to it. For example, the Williamsburg area in Virginia has a lot of cases. But where you have the worst cases of all, the highest death rate, the highest mortality rates, are these senior centers, whatever you want to call them, nursing homes, long-term care facilities. There's one in Henrico County, right outside of Richmond. Well over 40 people have died there. It's actually worse loss than that first one in Seattle, Washington. And so, in my view, as we reopen our society and our economy and stop this devastation of livelihoods and of lives, I think those who are most vulnerable need to be protected, even as you open up. And we know who are the most vulnerable. It's those generally who have diabetes, who have what you might call pre-existing conditions, hypertension, high blood pressure, maybe heart diseases, anything dealing with one's lungs. And those, for the most part, over 60 and particularly over 70 years old. And those who are most vulnerable, the people who are most vulnerable, ought to be protected. Meanwhile, I think we certainly sooner rather than later need to uncage Americans and their jobs. And when you have governments saying, well, this is an essential business and this is a non-essential business, well, these so-called decreed non-essential businesses, the people who own those businesses, they're mostly small businesses, it's really essential to them. And it's really an essential business to the hundreds, if not thousands, there's thousands of people who work for these businesses. And so I think we'll still have social distancing. I think what the doctor said, you need to wash your hands more frequently, practice better hygiene, sanitation will be important. But I think also important in the midst of this is getting manufactured and distributed literally millions, hundreds of millions of these instant tests so people can determine whether or not they have it. And in fact, say somebody's got a business where you have customers coming in, they'll want to test their employees to make sure that their employees don't have the disease, because they'll be worried about liability, that if one of their employees passed it on to a customer, then they'll say, well, it's the fault of the business. So everyone is going to have to slowly, we're never going to get back to norm the way it was before. This is going to change a lot of things in our way of life. Teleworking is going to be more commonplace. I think I've been an advocate of teleworking for 30 years, and I think that'll be more prevalent. Distance learning will become more prevalent. And I think there's going to be just a greater awareness of what needs to be done to try to stop getting any diseases. And when this is all over with, and the sooner the better, and it'll get phased out or reopened across our country, community by community, region by region, and ultimately state by state. I hope that never again do we have to have this kind of response where the governments at the federal and the state levels are shutting down our economy and devastating lives and livelihoods. There's got to be a better way of doing this than this approach. And I know we're flying blind, we're still in the middle of it, but what we aim to do with the National Coronavirus Recovery Commission is to give ideas of what needs to be done in the future to make sure that our economy, because you have to have a strong economy to have strong, safe healthcare system, and you need to have a healthy people for a healthy economy as well. The one thing that I think we can learn from all of this and compare it to flu seasons that have anywhere from 20 to 70,000 deaths a year in the United States. But one thing that is really grating to me, and I think a lot of other people, is how much we are dependent on China and some undependable countries for our medicines, for our pharmaceuticals, for our devices. And you all have heard me talk about energy independence, and we're now energy independent. We need to be also for our healthcare and medicines, health-wise or pharmaceutically independent. And we need to have the right policies, the tax, the regulatory policies to say, let's be making these medicines, these drugs, these pharmaceuticals and devices here in the United States, or at least with a country, say it's Canada or Mexico or other countries that are allies, rather than being vulnerable to a country such as China that doesn't necessarily, I'm being diplomatic, that doesn't necessarily, number one, they don't share our values, and secondly, no one would ever consider them an ally.
Speaking of China, Governor, one thing I've always said is we never would have given any of the treatments we're given to China to the Soviet Empire back in the days. I mean, China is still red. They're still communists. They still say nobody died at Tiananmen Square. They still make stuff up. I think we should do tax incentives for business to leave China. I think tax credits. I think the president's right on the money on what he wants to do. I mean, if people, the left likes to scare you by saying the iPhone is going to cost you $5,000. Well, the market will determine that if it's $5,000. If you want to pay $5,000 for a phone, go, more power to you. You go buy the phone. Otherwise, they'll have to figure out a way to make the phone cheaper. They can make it in South Korea, where their competitors' phones made, the Samsung and the Android phones, which is their biggest competitor, and it's about the same price, or it might be a little less. Marcus, you might know about that. Is that phone cheaper than the iPhone a little bit, or is it about the same price?
Well, I think
regardless of
the
cost.
Yeah.
We once did have a lot of. Dwight, here's your point: is that we got to make America. One of the tax reform that was passed a few years ago, the U.S. used to have the highest tax on incorporated businesses in the world. We're now better than average, and so on tax policies, that's fine, and so we're better there. But I think what you said is right, and that is to make sure that our tax credits for, say, research and development, and the taxes for pharmaceutical manufacturers or for medical device manufacturers is as competitive as any in the world. So much of manufacturing these days is modern manufacturing. And so the labor costs, the people that are getting hired in manufacturing need great skills. And I think for the long-term job growth of our country and our national security, it ought to be a government policy that we want to make sure that everything that we're doing by policies in the U.S. it makes it attractive to be here in the United States of America. And then let different states compete for those facilities. Maryland actually has a lot of pharmaceutical and medical expertise. You have the National Institutes of Health, Johns Hopkins University, and others. And so your taxes are too high, and you don't have right to work laws. But regardless, the point is that I guarantee you the states that win in getting these pharmaceuticals will be states like Texas and Tennessee and Florida, and states that have no state income tax, and they're very good for business. And North Carolina does well as also. But the point is as a national policy, we ought to say never again are we going to shut down our country over a virus. But more importantly, and as a long-term job growth approach and national security issue, just like energy independence, we wanted no longer to be vulnerable to hostile, volatile, and unfriendly governments, and we are now energy independent thanks to the creativity and innovation of hydraulic fracking and horizontal drilling and all the rest. That's a geological and technical issue. This one time in our country, Puerto Rico, because of the tax laws, was a great place for pharmaceutical manufacturing. And so they're saying, oh, let's do this again for Puerto Rico, which is fine. That would be great. But why not make the whole United States and our territories much more attractive for pharmaceutical manufacturing?
Governor, I wanted to draw on your experience as a governor. Certainly governors are very much on the front line of these kinds of crises. Obviously, this was an unusual one, but it comes in different shapes and sizes and kinds of emergencies. And I'm sure you thought about this as a governor. Do you have any kind of advice to governors as to how to proceed and how to respond to situations like this?
Well, hello to Nicolai, who supposedly just said howdy.
Yep.
I think the governors, Governor Hogan and all the governors are doing their best. I may do things differently. I don't think at this point I'd want to make a public statement of criticism of any, maybe to be positive about. I like the approach that Governor Abbott of Texas has been taking. I think the governor of North Carolina, where the way he shut things down were for periods of time, say for 2 weeks, as opposed to shutting things down for 2 months. Why don't you see what the data is? I think you're going to, and in fact, Governor, just before I got on this, I was listening to Fox Business, and they said the governor of Oregon says, well, we're not going to open up Oregon and Western Oregon's completely different than the coastal area.
Right.
And they said, well, the whole state has to be treated the same. Well, I don't think the whole state is the same. That's up to the governor of Oregon. Whereas Newsom, the governor of California, is saying, well, there's different areas that can be opened differently, that's the approach I would take. Is that, all right, well, you have certain areas, and you all alluded to this, and Dr. Ackerman brought it up. Some rural areas, they don't have any problems with this. And so you treat different regions of your state differently. Then you get into place. Here's another thing for competition in business is, say you have a place like Bristol, which is on, the State Street goes right. One side of the road is Tennessee, the other side is Virginia. Well, if Tennessee opens up the Tennessee side and Virginia is still closed down, that's just going to have an exodus of people going to businesses on the Tennessee side. And so sometimes you're going to have to work across state lines. I think, for example, for Maryland, in the counties, Montgomery County, Prince George's County, Arlington, Alexandria, Fairfax, Loudoun, maybe Prince William, that, the whole district and the district itself probably want to have something that they work in concert in the so-called DMV area, which is fine and logical. And especially since you have the public, the whole metro system, that people probably aren't going to use as much in fear of disease, but I think it's a cleaner system than what they have up in New York City, where you used to see videotapes of rats eating pizza and all the rest of the stuff you'd see in the New York City subways, which have never been looked upon as fastidious, clean places. More like,
I think the New Yorkers would agree with you. The subways are not
well,
fastidious.
The one thing about New York, though, as bad as they were hit in New York City and New Jersey and Connecticut, the ones who survived, and here's the reality, is 97% of the people who get this disease are going to live. It's not just if you get the disease, it doesn't mean you're going to die. If they have those antibodies, their blood's going to be really, really valuable blood, and they're going to be immune from it, not having to wait for this vaccine that'll probably take at least a year. The shorter term medical approach is an antiviral therapeutic. And that could be developed in the next 4 to 6 months to be in effect and helpful before the recurrence that is likely to occur to some extent up in the winter months later this year.
Well, we certainly look forward to your commission that you're serving on with coming up with suggestions. I'm struck by the fact that in February, the advice was that masks wouldn't help you, and then in April, that got changed, and there was some recognition that masks could be helpful. So hopefully,
well, I keep my neckerchief around here.
That works too.
It's not quite as good as what they want, but here's the thing that thank goodness, and one thing that would have been great is if we had stopped, and it got criticized. The president stopped travel out of China. That was actually a really good thing that he had done that. And sure, a lot of things could have been done a little bit earlier, but that was a really important one to do. And then shutting down travel out of Europe, and then later Ireland and Great Britain. from it. But I think people have learned, and I think that we need to, it's going to change our lives. We're going to be cleaner. We're going to have more sanitation. We're going to be in a depression in some segments of our society, of our economy, sadly enough, until a vaccine is found. There's going to be more people, some people who are risk adverse and some who are less risk adverse. And so even when it opens up, there are going to be people who are very, very cautious, and others that say, well, let's get after it. Like Farragut in Mobile Bay, damn the torpedoes, full steam ahead. I just would like to see the American people and our livelihoods uncaged sooner than later, safely, with a special protection for those who are most vulnerable, and others practicing more safe ways of social distancing. People aren't going to be shaking hands. They're going to salute. They're going to wave. They're going to bow, and just say howdy to folks.
There you go.
So
That's the way to go. And then the goal is, of course, you got to get the football season going this fall.
Marcus, you had a question.
Yeah, what you were talking about the regional approach, I thought is fascinating and pretty spot on, in that when you look at how it affects the Washington metro area of Northern Virginia, Washington, and Maryland, and the Washington-Baltimore corridor, that approach might be different than the western part of more rural parts of Virginia, Western Maryland, or the Eastern Shore. And then, jumpstarting the economy in those different areas might look a little bit different. And I think that's a pretty fascinating point. And additionally, though, I was wondering, how might small businesses and technology companies that deal with either implementing software or, in some sense, geospatial software, mapping and trading mapping data, or just exchanging data, how could maybe they help with the overall efforts? It seems like.
Go ahead.
No, I mean, it seems like there's a lot of possibilities there as far as trying to drill down on where you can focus your efforts, where the various infection rates, and digging into that data, or just how can the sort of information technology and cybersecurity community as a whole help with the I don't want to say restarting of the economy.
That's a really great question. We're going to reopen our economy, but in the midst of reopening our society, you still want accurate data. The data everyone's getting now is, it seems like, at least a day old, or some of it on the fatality rates or fatalities. They don't even bother with rates. They make us have to do the calculations on it, because people will see, gosh, the fatality rate's probably the worst anywhere in our country is around 5%. There's other places it's less than 1%, but that depends on who actually gets it, gets the disease. Here's where I think technology can help. And obviously, the modeling on this has been a failure. It's been grossly overstated. But it's based upon data, and there's suppositions. And what those suppositions are, that's the results you're going to get. And, they say, data, I'm not going to use the term on this, but, such and such in, such and such out. So I think there's ways, I think, that you can get this information quickly. And so you don't need humans doing it. It's just interacting with data. As it gets into one system, it gets put into another. And then the key for leaders to understand what is happening, I have these flags above me. These are countries that supported the U.S. after 9/11. But you want to flagging things. There's a company I know, Singlifics. They're actually out of Arlington, and they can have different colored flags, and by whatever metrics you're caring about, is whether it's a spike in the number of reported cases, a spike in the number of deaths, say a decrease in the number of available beds or ventilators, or whatever metrics you want that can help someone analyze data. And the other data that I think is really important that is missing is right now that the studies and all the stats are county by county, and they'll consider a city a county. And that's all very interesting. But for people really to know what's going on, you'd want to make it almost by zip code or by census tract. So if you live in, I live in Virginia Beach now, which is a very big, it's the largest land area city. And there's more than half of it's rural countryside. Then there's the beach area, then there's the inside parts, and then there's a town center area and different things. Or just take Montgomery County. Let me just take your county, Montgomery County, Maryland. There's a big difference where you are. So if there's a problem in Bethesda, that may not be the biggest concern for people in Potomac. But if there's an outbreak in Potomac and nothing in Silver Spring or nothing in Bethesda.
Actually, Governor, in Maryland, we have broken out the statistics
Great.
by zip code.
Great.
And it is some of the issues that you're addressing have been really kind of fascinating because of precisely those variations that.
All right, we need to learn whatever you're doing there in Maryland. Tell the folks in Virginia to do it. But again, if you have technology, back to the question,
right.
If you have technology, but it's not just looking at a chart of figures and you just think, all right, well, there's that many in this zip code. There are ways of having a notification, a flagging for deciders, for public servants who have to make decisions, to help them understand what is happening with literally thousands and thousands of different data points, that if you're just looking at numbers or even percentages, it'll be difficult. But it helps, technology will help decision makers make better informed decisions sooner, quicker, and more accurately, and help get assets where the assets need to be and attention where the attention needs to be, rather than a broad brush approach that may help some and be an unnecessary pain for others. Great.
Well, we've come up towards the end of our time, but we really appreciate you've given us a lot to think about, but also a lot to hope, because I think you're asking the right questions as, what can we do to get going again, which is, I think, something a lot of us are all looking to do, and to do it, though, in a safe way. So thank you very much for coming on the show, Governor.
Thank you, Governor.
Thank all of you all, and I commend you all with the whether you're people listening from Prince George's, but I suspect there were some from Arizona apparently, but
yeah,
mostly Montgomery County, Maryland folks. And thanks for your leadership, and stay positive, stay sane, and keep your spirit strong.
Thank you very much.
Thank you, Governor.
Thank you, Governor.
Adios.
Right. Okay, so that is it for this episode of Dr. Politics and
Next week we have a
No,
very
not Dr.
Direct
Politics.
Line. Direct
You
Line.
have become Direct Line. I did that last week also. Okay, thank you, everyone.
Thank you.
okay.